Hi, I'm Holly Castora, a senior certified Iyengar yoga teacher living and practicing in Bucks County, Pennsylvania. And today we're going to be practicing Chaturangasana through the chair and some other asanas that are therapeutic for lower back issues. You may see either Krishna in the background practicing with me or Sham Das. Oh, there goes Krishna. They like to do yoga. I'm not really sure that they're in a yogic state of mind, though, most of the time. Okay, here we go. So I'm kneeling in front of the chair, much like as if I was going to press down on the chair to lift up and arch back for Ustrasana, but instead of going backward, going to come forward through the chair. So these are the ASIS, we call them sometimes the frontal hip bones, okay? And I'm going to place them on the edge of the chair seat. The pubis is off the chair seat. So I'm coming through the chair, extending my legs one by one. Do you see how I don't lift my, tilt my pelvis forward to do that? And then I'm just going to shift forward a little bit until I have both of those pelvic heads on the edge of the chair seat, and I've rolled them in towards each other, okay? And then I take my hands forward, bring my head downward, bend my knees, and bring them inward towards my chest. And I'm checking to see that my outer hips, outer knees, and outer ankles are all in one line. And I don't know if you can see this very well, but my shins are barely touching the floor. They're sort of like grazing the floor. But I'm a shorter person. If I was taller, I would put more mats on the chair to build up the height. Sometimes when I've used this pose for back issues, for pain in my lower back, it feels better to arch my lower back a little bit, but then you see my knees come up off the floor slightly. Sometimes it feels better to round my lower back. Other times it feels better for my lower back to be in a more neutral position. So I would say try everything and do the needful. In India a few years ago, Gitaji told us that we should imagine the four sides of the abdomen opening up like a hanky from the center of the navel to that outer upper right corner to the outer upper left corner, from the center of the navel to the lower left corner, from the center of the navel to the lower right corner. And this was in Virabhadrasana 1 and Virabhadrasana 3. And I think of that often when I practice Chaturangasana over the chair. That the abdominal region is wide, tall, and not hard. Nor is it pushed outward. The support of the chair holds the contents of the abdomen against the anterior spine. And then to come out, just back up a little bit. I watch out for little baby Krishna. And that's Chaturangasana.